Okay, first let me thank the YouTube channel who actually provided the content for information I'm about to post. So, Alon Nutritional Systems, I believe. I will tag you in this video. Um, I would like to thank you, even though the content is 8 years old, and I appreciate you keeping it on your page that long because I need it because people are really starting to work my nerves. So, 5 days ago, I posted a video of Dr. Muhammad basically breaking down the uh, COVID 19 information, and he broke it down more than a lot of other people. Now, there's some doctors on here that break it down as well, but again, he broke it down, and a lot of people question who he is, what he is, all of that. So, even though this is 8 years old, Dr. Mohammed, excuse me, but I still think it's a really good video to show who you are. Okay? So I think it's very important that people understand your profession. So I'm going to go ahead and post this. And yeah, thank you very much.
My name is Abdul Alim Muhammad. I'm a medical doctor. I have a practice in Mitchellville, Maryland. And I'm formally trained in general surgery. Well, as a college student, I became a member of the Nation of Islam. And I was interested in doing something that I thought was worthwhile. So my first choice was to become a school teacher, and that proved to be no challenge at all. So then I went to the other extreme and I said, well, what's the most difficult thing I can think of for a person to do? And I thought at the time it would be medicine. So I got interested in that and went to medical school and then did 5 years of training in general surgery. I chose surgery as a specialty because I was literally interested in everything. And the professor says, well, no, you have to choose a specialty. So I said, oh, okay, if I have to choose one, which one is the broadest? Which one goes deepest? And so everybody seemed to think that it was general surgery, because to do surgery, you have to know medicine, you have to know pediatrics, you have to know pathology, radiology. All of the other specialties are folded into what it takes to practice general surgery. So that's what I did for 5 years at Harlem Hospital in New York. And I'm glad that I actually took that route because it has given me a breadth and a depth of understanding of clinical medicine that holds me in good stead to this very day. Part of the teaching in the Nation of Islam is something called How to Eat to Live. So we were taught as a part of our religious training, that there is no healing in medicine or drugs, but that the cure for our ills is fasting with the right food. And so I always had an understanding that there was a connection between what we ate and how well we were as people. Now, it's interesting, in medical school, in 4 years, we had one lecture on nutrition, a one-hour lecture on nutrition. So I'm the guy in the back of the room. How come we only get 1 hour? And the professor, looked at me very sternly and said, young man, that's all we know. And we still had time for questions. So right then and there, I realized that this was a very important area of study, but that I was not going to get that kind of information from a medical school. I got countless hours of instruction on how to use drugs. But nutrition, it's all the dark ages there. So that was a personal study over a number of years. And somewhere around 2004, 2005, a doctor friend of mine in Philadelphia told me about standard process products. And I started fumbling around trying to learn how to use standard process. And it became a substantial part of my practice at that time. And as a result of that, I was invited to a standard process symposium in 2005 in Lake Geneva. And one of the presenters at that symposium was a certain Dr. Freddie Ullin. And he gave a presentation on how to manage a $1 million nutritional cash practice. And so that's what I've been looking for many, many years, how to actually do this in a way that made sense. So I met Freddie and his wife and signed up for the $1 Million seminar down here. And I did that in December of 2004 and went back and have been in the process ever since of constructing, a totally nutritional practice. So for a few years after that seminar, it was a mixed practice. It was standard medicine and other alternative therapies and some nutrition along the side. And then as time has gone on for the past 2 years now, it's exclusively nutrition. And the reason that it's exclusively nutrition is because nutrition works better than anything else. So why waste time doing things that aren't working quite as well? Oh, well, I think the number one benefit to me as a practitioner is the absolute confidence and certainty that one gains through the use of the nutrition response testing, coupled with the fine products from Standard Process and other companies. The problem in modern medicine, besides the inability to make a diagnosis, is that most doctors are scared to death of their patients because for the most part they know that they don't have anything that can really help them. So I would say that the greatest thing about nutritional medicine is that you can always help. Even if you can't completely produce a cure, you can almost always substantially help an individual who is willing to adopt a different diet and who is willing to be compliant with a nutritional program. I think this stems from a very simple understanding that the body itself is the result of nutrition. What you are is what you eat. Or we could change it a little bit and say, you are today what you ate yesterday. And if what you ate yesterday wasn't so good, then guess what? Your body today is not so good. But if we improve the nutrition, if we give the body what Freddie calls the genuine replacement parts, then the body knows how to rebuild itself. It has that original wisdom of how to build itself. And all we're doing is helping it along by making a proper nutritional diagnosis and then finding what the successive nutritional programs need to be in order to reach optimum health.